Tonsillitis. It is the inflammation of the tonsils. The tonsils are the group of lymphoid tissue present in the back of the throat, the pharynx. The lymphoid tissue are meant for first line of defense in human body. Tonsils has been divided into various groups: adenoids, palatine, lingual, and tubal tonsils. Mostly infected group is palatine tonsils. It is a pair of groups of the lymphoid tissues. So lymphoid tissue produce on the entry of the pathogens B cell, T cell, monocytes, which are the defense cells in the human body. They attack the pathogens and tries to kill the infection to make the body healthy. So when the pathogens get entry through nasal pathway or the oral cavity and they enter the lymphoid tissue present in the tonsils, especially palatine tonsil group, they produces inflammation. Initial irritation that lead to the inflammation, which causes enlargement, edema, and painful and sore throat. When the pathogens approaches the palatine tissue or the lymphoid tissue, they send alarming call to the other parts of the body related to the immune system. So the cells from the defense cells, that is the team of the defense present in human body, approaches at the site of the pathogens, and all of the cells collectively tries to do their best to eradicate or kill the pathogens to make it clear and to maintain the health of the body. So during this fight, there is production of cytokines that produces inflammation. So there is pus formation follicles in the tonsils that causes the disease that is called tonsillitis. It may be initially acute that passes into the chronic tonsillitis when there are repeated attacks of acute tonsillitis for several years. It is a disease of children and teens. It starts from 5 to 19 years. So after 19 years, these tonsils, they don't play the role of defense, whereas the other defensive system in the body, that is the lymph nodes, spleen, other parts of the parts which are related with the defense system, they come into their puberty or into their maturity to attack the infection anywhere in the body. So it is usually the age period is from 5 to 18 or 17, etc. When there is inflammation of the lymphoid tissue, and this inflammation or the tonsillitis is divided into or classified into tubal tonsillitis, lingual tonsillitis, palatine tonsillitis, and the adenoids. Mostly the palatine group is the sufferer ones, and they are considered as the tonsillitis disease. So these are the basic pathophysiology of the tonsillitis, which is usually the disease of the children and the teens. The etiology of the tonsillitis, inflammation of the tonsils or the lymphoid tissue, mainly and mostly is due to the viruses. Adenoviruses, rhinovirus, herpes simplex, influenza virus, these all viruses can produce tonsillitis in the body. In some certain cases, it is also produced by the bacteria, that is Streptococcus pyogenes. This produces the alarming and the very critical disease as compared to the virus. The, the period of recovery is from 1 week to 4 weeks. In acute case or acute tonsillitis is a curable one. It can be easily cured by the modern medicines, bed rest, adequate diet, and it can be overcome easily. But when it enters into the stage of chronic, then it is difficult to treat the tonsils towards normalcy. They have to be excised. The process or the surgery is called a tonsillectomy. The symptoms of the tonsillitis is sore throat, high grade fever, difficulty in swallowing, dysphagia, and in the last, the also produces the infection of the upper respiratory tract, which produces the difficulty in respiratory process, that is dyspnea. Moreover, there is enlargement of the neck lymph node, lymph adenopathy, that produces stiffness of the neck. There is redness and also obstruction in the, the difficulty and pain in the back of the throat. Mostly this infection is, this disease is a contagious disease, infectious disease. It spread from sick person to the healthier ones by the droplet infection and the by fomites. That is during coughing, sneezing, laughing, spitting, the viruses and the bacteria that spread from one person to the other person and causes the disease that is called as tonsillitis.